Okay, so let's dive in. Imagine you're facing, well, one of the most critical fields in medicine, obstetrics and gynecology. It's huge, it's complex.
Oh, absolutely. Vast is the word.
Right. Where do you even start to get a grip on it all? Especially if you need practical knowledge like yesterday.
Yeah, it's definitely a field where the sheer amount of information can feel pretty overwhelming. You're dealing with everything from routine stuff to life or death emergencies.
And across two related but distinct areas, really.
Exactly.
And that brings us to our deep dive today. We're looking at descriptions of a specific resource designed to help with exactly that challenge.
Okay.
It's a book titled 100 Questions and Answers in Obstetrics and Gynecology for Medical Students by a Dr. Atef Ahmed.
Ah, okay. 100 questions and answers. So the structure is right there in the title.
Pretty much. So our mission really is to unpack what this book is. Why is it positioned as, a potentially valuable tool?
What makes it tick? What's its unique angle on learning this stuff?
Exactly. How does it try to cut through all that complexity and give you the essentials?
Let's get into it. So the core concept is that Q&A format. 100 specific questions, each with an expert answer.
Yeah, that structure itself is interesting, isn't it? Why frame a whole field that way?
Well, it suggests a very deliberate approach to learning, I think. Instead of just presenting information passively, like a textbook chapter,
Right.
it frames it as problem solving, which for OBGYN, where so much is about answering questions, solving diagnostic puzzles.
Clinical thinking.
Precisely. That Q&A structure could be, well, really effective for building that clinical mindset right from the start.
Yeah, preparing you to think on your feet. Okay, now the author, Dr. Atef Ahmed, the sources highlight him as a renowned expert. Years of experience, not just treating patients, but also, and this seems key in medical education.
And that combination, clinical expertise and teaching experience, that's often the gold standard for a resource like this.
Why is that?
Because he doesn't just know the medicine, he likely understands how students learn, what the common hurdles are.
How to explain complicated things clearly.
Exactly. That background gives the book a certain authority.
Definitely lends weight.
Yeah.
Okay, so what about the key features? What does the description say makes this book stand out? First up is in-depth coverage.
Okay.
It apparently tackles these 100 chosen questions to cover fundamentals, but also recent advancements and even clinical case scenarios.
That mix sounds vital. You absolutely need the basics.
Can't skip those.
No way.
Mm.
But medicine changes so fast, especially OBGYN, so the latest info is crucial. And case scenarios, well, they bridge theory and practice.
Make you actually apply the knowledge.
Right. Force you to think through a real situation.
But depth can sometimes mean dense, hard to wade through. So the next feature they emphasize is clear and concise explanations.
Oh, clarity. Yeah.
The answers are detailed, apparently, but the focus is meant to be on making them easily understandable.
Which is so important. Just having loads of detail isn't helpful if it's not digestible.
Especially under pressure, like studying for exams or even on the wards.
You need information that sticks, that makes sense quickly. Clarity is absolutely paramount.
And it's positioned very much as a practical learning tool, not just theory.
Okay.
It's explicitly for exam prep, sure, but also for enhancing critical thinking.
Which that Q&A format helps with.
Right, we touched on that. And also bridging that gap, between the textbook world and the actual clinic.
I like the dual focus. Helps you pass the tests, which you have to do.
A necessary hurdle.
But it also aims to build the skills you'll use day to day with patients. That's a powerful combo.
And the final point, linked to what you said earlier about things changing fast, up-to-date information.
Essential.
It says it incorporates the latest guidelines and research.
Yeah, you really can't afford to use outdated info in OBGYN. Treatments evolve, best practices change based on new studies.
Patient safety depends on it.
Absolutely.
Yeah.
So a resource that prioritizes being current is, well, incredibly valuable.
Okay, so let's recap that bit. It's a Q&A book, 100 questions by an expert educator. The focus is practical, clear, up-to-date info.
Structured problem solving, essentially.
Yeah. So who is this actually for? And if you're listening, what might you get out of something like this, assuming you're in that learning space?
Well, the description mentions a few groups. Medical students, obviously, looking for a study aid.
Makes sense.
But also residents, maybe even practicing healthcare providers who need a quick review or an update on something specific.
Okay, so broader than just first-time learners.
Seems so. And even instructors or educators may be looking for a teaching framework or question bank.
So if you fall into one of those categories, it's supposedly designed with your challenges in mind.
Right. And connecting those features we talked about to the benefits for you.
Go on.
Well, for exam performance, it's tailored to the curriculum areas, so it should directly help us studying.
Enhance exam performance, yeah.
And for clinical skills, those real-world case scenarios are key. It aids clinical skill development.
Getting you ready for actual patient encounters.
Exactly. And just the format itself, Q&A, makes for pretty convenient learning.
How so?
You can target specific topics you're struggling with, or just use it for quick reference if a question comes up during rounds or studying. It seems flexible.
Okay, now this is where we get a real sense of the scope. To make that in-depth coverage feel more real, the description lists some of the areas it touches on.
The specific topics. Let's hear it.
It's pretty vast. Starts with the fundamentals, like routine pregnancy care.
May basic.
And labor and delivery. Core stuff.
But then it goes into really specialized areas, too, like maternal fetal medicine.
Serious pregnancies, right?
Exactly.
Yeah.
Managing complex situations for both mother and baby.
Then there's the whole GYN side, gynecological disorders, various gynecological surgeries.
Plus preventative care, which is huge. Things like screenings, contraception.
Crucial. And it covers different life stages, too. Menstrual disorders, menopause management.
And quality of life issues like pelvic and sexual health. Really broad.
And you absolutely need this. Obstetric emergencies. Things that require immediate correct action.
Knowledge you just have to have cold. And it even mentions things like fertility treatments.
Prenatal care, postpartum care.
Right.
The list goes on. Pelvic health, educational aspects.
Wow, okay, just listing those few examples really drives home the immense breadth of OBGYN.
Doesn't it? From the routine checkup to the complex surgery, from fertility to menopause, pregnancy to emergencies.
It shows why a structured approach, like 100 key questions, might be really appealing to try and get your arms around it all.
Exactly. So, wrapping up this deep dive then, we've basically explored a resource, this book by Dr. Atef Ahmed.
100 questions and answers.
Right. Designed to help learners tackle this huge, complex field using that structured Q&A approach.
And its purpose, based on the description, seems to be providing comprehensive current knowledge in a really practical, accessible format.
Aimed at boosting both the theory understanding and the clinical thinking for students and practitioners.
Making that connection between book smarts and clinical practice.
So, thinking back to that list of topics we just touched on, pregnancy, emergencies, fertility, surgery, menopause, screenings, all of it.
Yeah, the whole spectrum.
This look at the resource really highlights just how incredibly broad, but also how interconnected all the facets of women's health are.
It really does. It underscores the challenge of mastering the field.
And maybe why a structured, question-focused approach like this book offers is seen as such a potentially helpful way to navigate all that complexity.
Makes sense.
So here's a thought to leave you with. Considering that huge range, that interconnectedness from childbirth to chronic conditions, what does this comprehensive view tell you about the kind of holistic care that's really needed in obstetrics and gynecology? Something to ponder.